visualize these two, and we visualize the aorta, we can interrogate the lung anteriorly. We can go up to the second rib space in the peristernal. We can change our depth to try to maximize visualization of the pleural line. We can image what Dr. Lichtenstein describes the bat sign. Try to move the probe over toward the sternum. And thus we can visualize the ribs. Those are our landmarks for the pleural line, which is going to be just inferior to those ribs. This is what Dr. Lichtenstein describes as the bat sign. The bat's head is in between the two ribs, and the ribs are actually the bat wings. You can visualize the pleural line as a hypercoque bright interface. Dr. Atkins is using the zoom feature so that we can visualize the shimmering of the visceral and parietal pleura as it slides across. As Ben takes a deep breath. As Ben takes a deep breath. This is the B mode representation. If we want to have a dynamic pictorial of this, we can use the M mode. We hit the M mode once, it puts one line of sight, hit it again, and thus displaying what's typically called the seashore or beach sign. In the near field, where there's waves onto the beach, the pleural line being the beach, and the sandy shore is the granular appearance of the moving lung. Visualizing on that image, there are A lines. Here, another M mode tracing showing the typical expanded lung, no evidence of pneumothorax because there's the granular appearance of the moving lung on the M mode. We can image the left side of the chest, putting the probe in the peristernal with the probe pointing cephalad, again next to the sternum. The appearance of the ribs as you move toward the sternum, the ribs will appear more circular. As you move away from them, they will flatten out. And the purpose of trying to visualize the ribs is to image the pleural line underneath. There are lots of white lines on the image. Which one is the pleural line? Find the ribs. They're your landmarks to lead you to the pleural line. As you move toward the sternum, the ribs will appear more circular. As you move away from them, they will flatten out. As we move back over to next to the sternum, we, on the left side of the chest, can visualize the pleural line, and on this you can see A lines. A lines go across the image. They're located deep in the image. They are reverberation artifacts from the pleural line. A lines are significant for normal lung expansion. A line for across, A for aerated, A for normal. In distinction, B lines will be start from the pleural line and move in a vertical fashion, and they are, in a normal patient, considered comet tails. Abnormal patients, they would consider lung rockets and be more prominent. There are no evidence of lung rockets on these images.